Okay, we're doing something different today. I usually just work off this, and today we're doing Zoom for a remote audience as well. So my name is Judy Cairns. Did she introduce me? I'm with Silver Linings Counseling for Seniors for only. We've been around for about 8 years. We used to do seniors only, and after COVID, there were so many people that needed counseling because of all the horrors during COVID with younger people as well. So now we do all ages in the whole state of North Carolina. We have an office in Cary. We have 30 therapists. They're licensed clinical therapists that usually do either Zooms or telehealth, like just phone call if you don't want to do the computer thing. So today we're going to just kind of bounce around and talk about a few things that Miss Christina asked us to share with you. The first one is, of course, that's our introduction. Silver Linings mission. Oh, I think I did backspace, sorry. Our mission is to provide exceptional quality mental health counseling, for you while helping you live as independently as possible, physically, emotionally, socially. We're not here to change anyone's life because we can't. We're here to empower you to make the most of the life that you already have. We believe that all persons at any age should be able to live a life based on healthy, realistic possibilities rather than predefined limitations. There's nothing bad about looking for your silver lining. We're here to help you do just that and to live in the glow of a beautiful today. The subject we're going to be talking about today and trying to bring it all together at the end for you is the link between poor mental health and the increased risk of falling. How many people with a show of hands would have any idea of that those two would coincide? If you have good mental outlook, good mental positive attitude, it might keep you from having falls. I see some people. Okay, good. A substantial body of research all over the United States, for sure, probably the world, has established a strong link between poor mental health, such as fear of falling, anxiety, depression, and social isolation, and an increased risk of falls. We're going to talk about that several times, particularly in older adults, as these psychological factors can lead to reduced physical activity, impaired balance, gait, and a heightened focus of potential falls, ultimately contributing to a higher likelihood of falling incidents. Mental health is a very fine balance between all the aspects of your life, your social life, your physical life, your spiritual and emotional life. It impacts how we manage our surroundings and make choices in our everyday lives. It's an integral part of our overall health and well-being. Used to, all we heard was, you have to go to the doctor, you have to go to the doctor. That's all about physical health. But now we know that mental health is just as important as your physical health. And a lot of people believe, there's a lot to the old adage about, mind over matter. And you have a good mind and a great positive attitude, which I'm going to share some things with you all that will help us have a better attitude. Then you'll be more healthy. And when you have a good mental health, you feel comfortable with other people. You can laugh at yourself and with others. Have respect for yourself and for others, even if you have differences. And we all know how that is because of the last, year and a half with all the election stuff going on. And we have really close friends and families sometimes that aren't even speaking anymore because of that difference that they may have politically, but we're just all hoping that smooths away and we'll all get back to being together again. How many of you feel like you have today at this point in your life a good mental health? No, I love that. Look at you all. Yay. All right, that means you're able to meet life's challenges and address problems as they arise. accept life's disappointments, which is really hard sometimes to do. You can make your own decisions. You're still all very independent, I see. Share your environment whenever possible and adjust to it when you need to. And ask for guidance. Is that the hardest thing that you all find as we age, that you have, that is hard to ask for guidance from people because we feel we're old enough to know what we need to do, what we want to do, but so we don't really want other people telling us. But sometimes that's the best thing we can do, even if you just ask to get someone else's opinion. You don't have to do it, but it is okay to ask. Attention and support, which is often overlooked. We all need to be valued. I know probably every person in this room, you're either a homemaker your whole life, farmer, you worked in a public job, and you had a career, teachers, there's all kinds of careers out there. That probably is how your self-esteem has been built all your life, attached to your job and the people around you at your work that depend on you, and your families who depend on you, and your children, grandchildren. And we all need to be valued. We need to feel like we're worthy. Most of us have come from a time in our lives when we've been surrounded by family and friends. These people help define who we are and where we fit into the world. These are the people who helped us feel valued and supported. But now things may have changed. Family is busy caring for their careers and the next generations, as it should be. This was something that was very difficult for me to adjust to. When my mother, because she was a caregiver, a farmer's wife and housewife, and she took care of 5 children, me and 4 older brothers. And after she and Dad got older and feeble, I just could not understand why she's still not taking care of all of us. It was difficult. It took me a couple of years to, and I never said anything to her, but now that I'm older and I have grown kids, I try really hard to make sure they understand the things that you think you're feeling guilty about with me. Like not coming to see me all the time, not calling me out. You have your own life, your own career, your own circle of life, and you need to be doing what you're doing right now. There'll come a time when they'll come back to us. It really will. I did it with my mom. I raised my family and I did everything I could for her and Dad, but sometimes it was difficult to take that time. And as we get older, I worked for 20 years as a director of admissions for assisted living and memory care communities. And that was the #1 thing that I found out working with elderly folks, is they feel like the kids just take them there and dump them, drop them off. They don't care anything about them anymore. But I wish then I knew what I know now, because they really need, everyone who goes into an independent or assisted living or even memory, they need to be educated and taught that there's a circle of life and your children are not dumping you. They just have their own things to do. So we need to give and take with them as much as we can. Anyway, that's enough about that. And then your friends. How about friends? Your friends may be having difficulties of their own adjusting to aging. They don't want to go out anymore and have lunch or dinner. They don't want to come over and play bridge. These are all things that affect our mental health. They may have moved away to live with their own families in a residence community in a distant town somewhere. Do any of you have friends that have gone and moved away? And then, of course, the last one is passed away. I can remember, again, I hate to keep using my parents, but I can remember Mom and Dad were the last of both of their families alive. They took care of a lot of their siblings and the friends in their community, in the church. And they were the last 2 standing. So it was hard on them to accept all that. Anyway, statistics, and we're going to start talking about fall risk because it does go arm in arm with our mental health. According to the CDC, approximately, and that's the Center for Disease Control, approximately 1 in 4 older adults age 65 and older in the United States fall each year. with over 14 million falls annually. Around 37% of those who fall experience an injury requiring medical attention or activity restriction, and nearly 1 million older adults are hospitalized due to fall-related injuries every year. How many people know someone who fell in the past year? Yep. My oldest brother died from a fall, and it's real. So key points about senior falls in 2024. The prevalence, roughly 25% of seniors fall yearly. The injury rate, around 37% of those falls result in injuries requiring medical attention. And hospitalization rate, nearly 1 million older adults are hospitalized annually due to fall injuries. And most common injury is what? Hip fractures. Yes. Who said that? Yes. With the majority of hip fractures related hospitalizations caused by falls. And then what happens when they get out of the hospital? They have to go to rehab and get strong again, right? And hopefully that's the path that we all will take. If we just have a hip that doesn't work anymore, we have to get it replaced or fixed, and we get some PT and we're fine. Hopefully we won't fall. We have to be very careful though during those times. The impact of mental health that it has on one's risk for falls include fear of falling. Can you imagine? I don't think as older folks, we really don't think sometimes about the fear of falling. We know our gait's not quite as steady as it used to be. We might have to have somebody hold our arm or help us. Anxiety can cause us to fall, depression, isolation. These are very real things that we don't even think about. I have a sister-in-law who fell when she was 60 years old, getting a vase out of a cabinet, and she's been disabled ever since. They have operated on that woman's leg probably 10 times, and she still can't get around. She's completely debilitated because she didn't even think that there was a risk when she climbed up on that 2-step ladder to get that vase, that she was going to fall backwards, get tangled up in the ladder, hit her head on a cabinet and the floor, and end up in the hospital for 4 months and then rehab for 6 months. And it's just never been right since. Anxiety, of course, if we're anxious about things and we're going about our everyday lives, we forget to stop and think about what we're doing. We're thinking about that anxiety, that cloud in our heads, right? So we need to be more focused if we can. Maybe every morning, get up and think about what I'm going to do today. And if I have to change a light bulb, I need to make sure somebody's standing by that step stool with me when I do it, or I need to call someone to come out and take care of it. Depression is so real, and the people that have it don't think about their health, their physical health. They're in a fog, and they sometimes can't get out without help. They need help. They need counseling. They need sometimes a doctor and medication. And then isolation. That's to me, the hardest for anybody, because when you're isolated, you don't ever know if anybody's going to even call you or come by and see you. So the main thing, and we'll have this somewhere else in my papers, the main thing I would encourage everybody in this room to do is, if you know a neighbor, a friend, a relative who lives alone, or even an older couple, please try to check on them every day. There's so many, if you watch TV, there's so many stories about people who nobody checked on them just for a day or two, and then they were found, deceased. So that's the one thing we can do to show how much we care about our friends and neighbors and family. And think about the people in your mind that feel that isolation. They need some company. Just a phone call. All right. And fear of falling. We're back to that again. When somebody has a significant fear of falling, they often limit their mobility, leads to decreased muscle strength and balance, making them more prone. Think about that for a second. If you're terrified of falling because you're steady, it does. You stop doing things. You stop exercising. You stop wanting to climb those stairs. You're afraid you're going to fall. And then the impact of that can create a vicious cycle because the fear itself restricts the activity and mobility, further worsening balance and increasing the risk of falls, which then lead to anxiety, depression, and isolation. So let's talk about those for a sec, those three things. Excuse me. Psychological impact of falls. Even a minor fall can exasperate existing fears and anxieties, further perpetuating the cycle of reduced activity we talked about. Physical decline. Poor mental health can lead to decreased physical activity and muscle weakness. Have y'all ever heard the old saying, if you don't use it, you lose it? It's true, right? I mean, I see that in myself. I used to be so strong in my arms and I can move my own furniture because I'd live alone, furniture around. And now I can barely pick up my cup of coffee in the morning. It's like, oh. So if you don't use it and exercise it, you will lose it. It causes weakness, which is known risk factor for falling. And cognitive impairment. Depression and anxiety can impact your cognitive function, which is your thinking, reasoning, and affect reaction time and decision making during potential falls. Important considerations with fear of falling. Assessments and intervention. We should include evaluation of psychological factors to see if there's anything that can be done to help prevent it. This can be started by talking to your primary care doctor, and if necessary, getting a referral to one of these professionals who can help you. And people like Miss Katrina, who can give you a wellness plan for your PT, and us who can give you a plan for your mental health for counseling. Multidisciplinary approach. Addressing mental health concerns often requires collaboration between healthcare professionals, medication reviews. When was the last time you had a medication review from your doctor, your insurance? Good job. And you know what? Yay. I have noticed my insurance company calls me about 5 times a week wanting to give me a medication review. And I'm like, I just did that. But if they call, it's a great idea because you go get your meds and you put it on the table and you go through everything. And believe it or not, I used to think it was a scam, and sometimes it could be, so you have to be careful. But if it's really from your insurance company and their pharmacy, they can go through all your meds. Because think about this for 1 second. How many of you only go to one doctor and that's it? Not one person in this room. We all go to different doctors. And how do they don't sit there and look at our files every day or so to update themselves on what we're doing. They barely look at them when we come in to visit them, right? So it's dangerous. Make sure somebody is reviewing all of our meds. I trust my pharmacy. If one doctor gives me something I'm allergic to or doesn't, it won't compete with another doctor's meds, they'll usually tell you. So med management is a great idea. And then mental health, reviews and talk with somebody about any issues you're having that we've already discussed. Social workers, counselors, physical therapists, family members, and clients to develop tailored interventions. Not too many people want to tell their families about their psychological issues, though. So that's why sometimes it's better to talk to a therapist like our company, counselor. We're completely unbiased. And you can say what you want to, because I don't care how close you are to that neighbor or that sister or that brother. There's some things we just don't tell other people because of judgment. We're afraid of judgment. And everybody is. It's normal. And then exercise and activity promotion. How many people exercise? I heard you talking about exercise. Yay! I am so proud of y'all. That's wonderful. And you have balance and strength training? Yay. How about walking? Keeping your muscles strong? Some kind of, yay, perfect. And does anybody a member of Silver Sneakers or YMCA, you are good. Or even just video. There's plenty of yoga, chair exercises. And I'm understanding now those are more beneficial, you are, okay, than some of the physical exercises on treadmills and things, because they can make you fall too. You have to be careful with that. All right, so the thing we talked about a while ago is very important. I want all of you to promise me that you'll think about, someone that you know that could use a phone call or a drop by once in a while to stay in touch with your elderly friends and family that help prevent dangerous situations and hospital stays just by checking on them. The next page is just references. There's a whole page. It's on the table of, if you all use a computer or they have one here in the lab somewhere, all of these references you can go to, and they will give you any information you want about the correlation between risk of falling and mental health and physical health. Does anybody have any questions yet? I'm running out of time. Okay. And then, of course, the last part, they're on the table, and I think I put it on some of the tables. There's how to reach us if anybody wants, and there's some referral forms on all the tables. Or all you have to do is fill out that one page, leave it with me. We call you, check your insurance benefits. We're one of the few mental health companies around that does take Medicare. So if you or somebody you know, you can take them home with you if you know someone that you think could benefit. What we do is check the insurance, verify it, and then call them or you or whoever back and say, your counseling sessions are nothing, they're zero, or they're $20 a session or 40, whatever your insurance covers. And some people have two insurances, so that helps too. And then I put these on the tables too, and there's some on that, how to reach us if anybody wants to call. So that's the end of the slideshow, but I got some more things. Can I close this out, Katrina? I want to talk with you about share. Okay. Stop. Yeah, I got it. Thank you. All right, so there's some miscellaneous things. If we don't cover all the rest of this, I put all this wonderful information on your tables, and there's plenty of it there. There's some little squeezy things I'm gonna leave you all. There are mental health sayings on there, like be confident, be calm, some of those things. Our brochures, pens. But I wanted to cover just a couple of things with you before I get gone. Grief. This is actually a whole presentation in itself. If the senior center here ever wants me to come back and do, I have 2 loss and grief presentations that are excellent for people that have lost and can't get over. It's part of life. And anyway, we're not going to talk about that one today. This is the one I do want to share with you. It's to positively prevent seniors from falling. Focus on regular physical activity like balance and strength training. Maintain good vision. Who's got their eyes checked lately? I just did. Anybody? Maintain that vision with eye exams, because if you lose your vision, what are you going to do? Trip and fall probably sometime, or run into something, or especially if you're driving still, that's very important. Review your medications with the doctor for potential side effects, because sometimes we just feel weird, or we don't feel good, or we feel dizzy, and it's just a side effect of a medicine that we're taking, or our blood's low, or our iron's low, or so don't forget your doctor's appointments. Who's got grab bars in their house, in their bathrooms? And I just watched a whole video on the references I gave you all, a whole video about how to set your house up. And I'm sure Katrina's probably has people that can do that too, to help you if you need it. And make home modifications like adding grab bars and improving lighting. That's one thing. I don't know why we as seniors, so many people's homes I go into are dark. I remember my aunt and uncle, they always had their air conditioner on, and it was always dark in their house, and I never could figure out why. But that lighting is very, you want to answer?
Because the wife told the husband.
Because it costs too much electricity. There you go. That might be true. And sometimes I think as seniors, my mom she couldn't stand the light. When we go anywhere, I had to put sunglasses on her because she just couldn't stand the light. So I walk in the house and go, hello, because everybody's got lights off. And anyway, improve the lighting, encourage them to wear supportive footwear. It looks like all of you have good footwear on. I tried to wear high heels till I had 3 total knee replacements, and now I can't wear them anymore. Always consult a healthcare professional before starting any new exercise program, unless you're working with a professional. So home modifications, this is on the sheet, and it's on the tables for y'all. Medicine management, footwear, lifestyle changes. How many people try to stay hydrated? I see everybody got some water sitting around. How important is that? Because if we lose our electrolytes from dehydration, get enough sleep. How many people get good sleep? Anybody have insomnia? Oh, what do you do for it? Just count sheep? Read. That's a great idea. Can you go to sleep pretty quickly when you read? No. Oh. But there you go. You don't want to go to sleep. Man, I find that on the weekends, I don't want to go to sleep because I'm watching those movies that have, seasons to them. Well-fitting shoes with good traction, we talked about. Avoid rushing when you get up from a seated position, because we're not used to that as we were when we were younger. We could just jump up and go. As we get older, we have to be careful with that. And then mindful of potential hazards around the home. Individualized approach. Each senior has unique, so tailor fall prevention strategies to your specific situation. Positive reinforcement. Focus on empowering seniors by providing them tools and knowledge to maintain their independence. And you all are doing that right now. You're giving yourself a chance to come out and be together and talk and learn and educate. And this keeps us positive, being around other people. And then last on this one is communicating with healthcare providers. Regularly discuss any concerns about falls with your doctor. Now, the very last thing, since I'm probably squeezing into somebody else's time, we're going to do a drawing, and I'll come back again someday and do this too. It's a journaling presentation on how to start from top to finish. But if you journal, has anybody in here ever journaled? Written everything down every day in a book? We did it as teenagers, girls did. We had a little diary with a key on it. But it's a wonderful, wonderful thing to do as we get older too, because you have all these things going around in your hand. And if you write it down, guess what? You can let it go. You go back later and read it and go, oh, that was nothing. Or, oh, I still got to do something about that one. But so here's paperwork for you all to put your ideas in your journal about how much water, food, caffeine, what are your plans today? Did you make a grocery list? That goes on and on. So I want you to take these papers and read them and sit down and read them and really and truly think about starting a journal. It's a wonderful thing to do. Keep you positive. And then another thing I put on your table is 10 tips to beat the winter blues. Those are fabulous. I'm going to do a drawing now for 4 journals. So, did everybody get a paper with a number on it? So I did 1 through 30, and we don't have that many people, so I might have to call out 2 or 3 times. Who has the number 4? I do. And this is just a lucky day. And who has number 12? Who has number 12? Okay, how about number 8? You have 8. And who has number 25? Do you have 25? How about 2? Joanne? Yay, Joanne. Congratulations. How about you? Thank you. You're welcome. How about 15? All right. We're coming out for that. Thank you. I appreciate you all taking your time to come and listen to me today. I never did get those put together, so. I did. So does anybody have any questions? If not, I'm going to turn it over to Miss Christina.
Thank you very much.
You're so welcome.